But then she said, I'm almost positive you have leukemia. And I started crying right away. I wanted to be as strong as I could for him, because I want him to know I have total confidence that we're going to get through it and we're going to be fine. And this is just this is a moment, a long moment, but it's not forever. It's not our life. It's just for now. I'm Kelsey Glasgow, and hobbies and things we enjoy probably changed a lot, especially since having our daughter. So generally just a love for being outside. Absolutely love being outside, even if it's just eating lunch outside, playing in the grass, but hiking, camping, fishing, and it's just anything outdoors. Anything outdoors makes us happy. So he started feeling really crummy. It was like almost we could pinpoint the day. It was mid-July of 21. But it was the late morning after he had left to go camping with his friend, and he called me and he said, I'm on my way home. I feel terrible, and just my whole upper body, even breathing. And he was driving home, on a dirt road, and it's bumpy and just everything. He was just feeling everything. And that was really weird. But we're 30, we're young and healthy. So I'm just sitting here like, all right, buddy, how much whiskey did you guys have last night? And, high mountain elevation sickness, people get that too. And you were sleeping on the ground, and we're 30 now. So you just kind of chalk it up to all that kind of stuff. We just kind of felt crummy the rest of the weekend, took it easy. And then he just was having several more painful episodes that were just concerning, more fatigue. So we started going to the doctor July, August timeframe, and they actually did do blood work, and his blood work came back normal. They did a chest x-ray. They talked initially his symptoms up to like maybe you strained a muscle like under your ribs or something, and just kind of take it easy. And so he was just having these like especially in the night or like early morning episodes where he was just waking up in pain. His upper body was just painful. And so it got to a point where, he just kept going back to the doctor. They prescribed him muscle relaxers, and like anti-inflammatories, and just that wasn't helping. The concern became greater when like the muscle relaxers weren't working, because we're sitting here like, okay, it's not muscular, like what's going on. And so, again, just a few more weeks go by, and he had gotten the Johnson vaccine, because we were really concerned with how hospitals were working with my pregnancy, that, if I, go into labor and you have to be vaccinated and you're not, will they not let you be there with me? So he got the Johnson vaccine and had a pretty moderate reaction. I wanted to take him to the ER, and he's like, no, they're just going to tell me it's a side effect from the vaccine. And so he didn't go. And you can just kind of see his pallor, like his color was not right. And so his dad had actually ended up flying out to come and visit with us, because he could even tell his son, like, he's not behaving normally. And so he went to the doctor on a Thursday. They actually repeated blood work. So this was like 3 weeks apart. And then I got home from work that day, and he was on the phone with her, and she said, your blood work's totally irregular, and I want you to get a CT scan. I ordered one for you tomorrow, but I really think you should just go to the emergency room because you can get one faster. The only thing that the ER doctor could tell us is that, your spleen's enlarged, your platelets are extremely low. And I've had a hematologist review your blood work, and he really wants to see you as soon as possible. And this was a Thursday night. But again, no one's diagnosed him with anything. And so I call Friday morning to this hematologist that the ER doctor gave us the phone number for. And it's a bit frustrating because we have no answers, but we have definite concern. And it's like a central scheduling phone number. It's not the doctor's office. And I'm saying, hey, this doctor said he needs to see him as soon as possible. And they were like, okay, well, he's got an opening at the end of the month. And this was like the first week in September. And I was like, no, like the end of the month he needs to be seen like today, if not Monday, like it needs to happen. Trying to be like, this is an emergency, end of the month isn't going to work. And the earliest they could do, the best they could do was that following Friday, so a week. And I was like, okay, I guess, schedule it. Well, over the weekend, his condition, is just plummeting. He started having like bruises everywhere. They weren't going away. Petechia all over his body. Just again, the color of his skin, he just was like sweating, and his gums started bleeding, which he's a dentist. His gums don't bleed. And so I called on Monday, and I kept making phone calls, and I honestly don't even know how I ended up getting on the phone with the triage nurse, and she was over at MD Anderson in Greeley, which is probably 40 minutes from our home. And she just said, bring him in, just bring him in. I didn't realize at that time, his primary care doctor who had done the blood work, who told him to go to the emergency room, she had actually sent some of the blood work off to a pathologist already. And so there were, I think, things going on in the background that we just didn't know yet. But so we get to MD Anderson in Greeley, and they send us to the infusion center where people are, do outpatient chemotherapy. And we're just kind of sitting there again. We don't know what's happening, but we're like, is it a mistake that we're here? Like, part of me feels like you don't get here unless you have cancer, but we don't know anything. And so one of the nurses actually brings us back to a hematologist oncologist office. And she says, hey, just based on some of the blood work we have here, and, talking with your doctors and the ER, we're pretty positive that, you do not have lymphoma. And I was relieved. I was like, yes, but then she said, I'm almost positive you have leukemia. And I started crying right away. And I think my husband was just sort of sitting there, and I don't know, you're hearing what they're saying, but you're not really hearing what they're saying. And I'm just thinking, I'm almost 30 weeks pregnant, and how does this, you just start spinning. And I asked the doctor, I said, is he going to be able to be with me when our daughter's born? Like, what's going on? And she said, yes, yeah, no, absolutely. And very reassuring at the time. And so, she said, we still have to get more information. He had to get scheduled for a PET scan. He had a PET scan, I think, the next day or 2 days later, and more blood work. So much blood work going on. And the doctor that was there, she was actually on like a 6-month sort of, she was like a traveling doctor. And so she was kind of letting us know, like, if it is the type of leukemia we think he has, it can't be treated here. We're going to be in contact with some doctors in Denver to see if we can get him admitted. And so more and more blood work going on. And he ended up having a bone marrow biopsy in Greeley, because they were trying to decide, they didn't really want to send him home, but they didn't know how soon he could get admitted down in Denver. But yeah, so he got his first bone marrow biopsy on a Thursday. And then that same day, Colorado Blood Cancer Institute in Denver contacted us and said, we have room for him. We'll take him. And so they basically sent us home that night to pack, because they said, you're not coming home right away. You're going to be there for at least a few weeks. And so, we headed down to Denver. And so September 17th was his first day of treatment for acute lymphoblastic leukemia. So his actual day of admission in Denver was my 30-week checkup I was supposed to have, and I canceled it. And the family kind of fought me on that. But I was healthy. I felt good. I'd gone to all of my other doctor's visits. And we actually had the first trimester of my pregnancy was weird. I ended up having bleeding, which can happen, but I think mine was a little bit higher risk. And so I actually wasn't allowed to do any like real physical activity or anything my first trimester. and there was a heavy chance that I would miscarry, but I didn't. And so I think, yes, that part was scary, but by the time I was at 30 weeks, everything was going really well. And to me, it was a no-brainer. I was like, I'm not going to miss my husband getting admitted into the hospital to go to I'll go to a checkup, a few days later, we'll figure it out. But my priority in the moment, I was like, she's in my belly and she's happy and she's with me. So we're just going to go together and do this as a family. Yeah, so I was 30 weeks the day he got admitted. I was like, they always say, like, the baby can hear the parents, they feel what you're feeling. And to me, I'm like, she's going to be around us, both of us, and hear us both as much as possible. So we're all going to stay together. And I'm going to be as calm and cool and collected as I can while she's still cooking. And I don't want that to be anything additional for us to all worry and stress about. I think too, as you're growing a human, and I think back to how I was raised and how I grew up and observing my parents, and then, putting myself into my husband's parents' shoes. And then of course my husband's shoes. I just kind of always thought, like, what example do I want to be for my kid? And how do I want to, remember this time and how I carried myself, whether it was for her or for him or for the rest of our family. And so I think I always use that as like a little bit of a motivation. And, I think just to always be hopeful and optimistic. I mean, to me, it was always just like, I'm going to hope the best and think the best until someone tells me I can't. And that's always just been my mindset. And I think to a fault in some ways, I think my husband and I both, tried to be strong for each other. I think he wanted to display, strength so that I wasn't worried about him, so that I could stay healthy to get through my pregnancy. And I think, I wanted to be as strong as I could for him, because I want him to know I have total confidence that we're going to get through it and we're going to be fine. And this is just this is a moment, a long moment, but it's not forever. It's not our life. It's just for now. We have such great support just outside of me supporting Seth. His parents and my parents and even his aunts. It's almost like the caregivers, they need caregivers. It never ends. We all needed each other. And I think that was so helpful for me, knowing that, like, if I needed to have a moment or a time to collect myself, and I was forced to do it a lot of the time. I mean, I wouldn't leave the hospital. I stayed there with him. It was almost like this solidarity thing. Like, if you can't leave, I'm not leaving. And we're roommates, and you and I are going to be dorm buddies for the next several weeks. And that's just how it's going to be. And family, they'd tell me, like, look, go for a walk, get out, and we'll be here. It was almost reassuring knowing, like, if I wasn't with him, someone else was with him. And same with our daughter. I mean, I knew the challenge would be much greater once she was actually born, because she wasn't allowed to be at the hospital with him. So, there would be times that I had to be with her, and it was very difficult, because I almost felt like I was always doing the wrong thing. I felt like if I was with her, I needed to be with him. And if I was with him, I should be with her. And no one ever made me feel that way but me. Like I said, I think the big thing is that, outside of just me being a caregiver and supporting Seth, he had care from the rest of the family and friends. And then, of course, I had that support as well. And, you're not doing yourself or anyone you're with any justice by not being present with them in that moment. So I just had to tell myself that if you're going to be with Charlotte, give her all the attention and love that she deserves right now, because you're not helping Seth by worrying constantly and not being present with her. And you're not helping her by not giving her all of the love and attention. And in a way, I kind of felt like, your daddy can't be here with you right now. So I'm giving you all the love from both of us. And kind of the same with him, when I was with him, just giving him all the love from her. I kept a blanket of hers with him in the hospital. So I would kind of like I know it's weird, have his like scent or whatever on it. And then every few days I'd swap some blankets out and then take that blanket back to her. Um, and just knowing, when, like I said, when I wasn't with Charlotte, she was getting the best care from her grandparents and aunts, and same with Seth. There's just no shortage of love and just fully trusting. Even his nurses, I mean, they were phenomenal. Because there were moments where he was alone, give or take, for a few hours or whatnot. And just knowing he gets so familiar with those nurses, that they were a great source of, relief, knowing that he was in good hands when there were moments where there was maybe a lapse of family being there with him. But just trying to be present, and it's easier said than done. But that's what I would just say is, you're not, like I said, you're not helping yourself or anyone else constantly stressing about things outside of your immediate control. We told his medical team from day one. Of course, they knew our situation. It was so obvious because I was super pregnant. He was home for almost every major event, holiday. So it worked out. His initial inpatient stay was 6 weeks. It was supposed to be shorter, but his first round of chemotherapy didn't work. So he was supposed to be on the pediatric treatment plan, which is strictly chemo, but it's, long, it's a few years. Initially we thought he was getting out after about 3 weeks. And then we got his bone marrow results back and it hadn't worked. And so that's when they told us, hey, we've got to start over with this chemo plan and we're going to do the adult plan. And on top of that, that's when we found out he was going to need a transplant. So that was a really hard day. I had everything packed. I was ready to go home. I was like, I'm getting this guy out of here, jailbreak. And the doctor had just made his rounds that day. And that's when he told us that we weren't leaving that day. And so it was another 3 weeks. And, we knew our kind of timeline. He was discharged October 29th and my due date was November 10th. So by the time he had gotten out, I was 39 weeks. And at that point, women are allowed to do elective inductions, which is actually, prior to him being sick, I told him, I was like, I don't really have a pregnancy plan or a birthing plan. I just really don't ever want to get induced. I just want to kind of let it all happen. But he was actually scheduled to go back in for more chemo November 8th. And so we knew we kind of had a window. And again, it's a control thing, right? It's almost like so much has happened outside of our control. And if I can control him being able to be there for our daughter to be born, I'm not going to miss that. The poor man, I'm like, she was born November 5th. And we got to leave the hospital the 6th. And so he was home for a couple days before, back to Denver for chemo. We live about 45 minutes away. But yeah, I was just, for me, from a recovery standpoint, I was like, I need to, I want to recover as fast as I can because I want to get back down to Denver and visit with him. But of course, obviously now, again, like I said, Charlotte, she's born, she's here, she has her needs. And, my husband, of course, was always very supportive in the sense that he knew I had to do what I had to do for our daughter, to take care of her while he couldn't be there. And we always had family. I don't think for the first year almost, we were never alone. Someone was always with us, which was amazing. So I think for me, it was almost like, this is your new job. This is the most important job you're ever going to have, whether it's, you being a caregiver for your husband or, your daughter, your child. And so that just became my, blinders on focus, that no matter what, I'm going to just give everything I have to them. And I guess I always told myself, you can do this another day. You can do this for one more day. And then the next day comes and you say, I can do this for one more day. And there were times where, it was really difficult. And I think almost every time it got to a point that you're just like, how are we going to get through this? There's a breakthrough. There's something something good happens. And I do think finding the good, even in the smallest moments, which can be hard because I think I get really greedy with my husband's recovery and you know where I want it to be versus where it is. And I think that you do in some ways get greedy about, well, I want us to be here now and we're not here yet, or I want us to be here in a few months and we're not there yet. And I think you have to stop doing that and start celebrating those little wins and be excited for them, even when, you know, they may seem small. Celebrate them because you need to, because it gives you hope for the future. It's kind of strange when you go through something traumatic. And I think there was a major part of me that you compartmentalize parts of your emotions and your life. And I think that during the treatment process, when he's in the hospital, and even the first 100 days after his transplant, I think that you have such a schedule, whether it's his care at home or his outpatient visits or just his medications and IVs and everything you're doing. And then all of my daughter's needs on top of that. I think that you're so busy that your primary focus is just, what am I doing now? What do I have to do in an hour? What do I have to, and so I think now we're in a place, probably since, you know, end of summer, early fall, where my husband became a lot more independent and helpful with our daughter. And we were kind of alone as our family unit. And I think you have this delayed processing of like, holy crap, like, and I think that, so we both started therapy. He and I both see a therapist, and I'm not saying like you go once and it's magic, poof. But she's been helpful, and you know, honestly, I wish we could do more, more therapy and more of that. I think for me and for Seth, I think our processing is probably a little different, what I need versus what he needs. I think for me, I'm at a point where talking with other caregivers is helpful, because you can try and explain to people what's happening or what you've been through. But, well, I'll say something, our therapist had told us, or me, she said it's not uncommon at this point in recovery where the caregiver and the patient actually start to progress at different rates. And she said, that's, I think, maybe where, again, even in your relationship, it can be more challenging, because there's almost this phase of like, I was so used to doing absolutely everything for him because he needed it. And now he doesn't necessarily. And I still want to do everything for him. And almost like stretching that muscle of knowing, okay, like, when is it right for me to maybe push a little to encourage him to have some more independence, versus when do I need to pick up that, extra slack in any facet of life. I mean, I think that advice would be, no matter what you're feeling, it's normal. I think for some, we're not all going to feel the same way, and our responses are not going to be the same. And I think that accepting that is okay. I do wonder sometimes if I'd cried more in front of my husband, maybe if it would have made him feel comfortable to do the same. Because I do wonder sometimes if both of us were trying so hard to be strong for each other that, like, we almost didn't allow each other to, express ourselves in a way maybe both of us were craving in the moment. So, I do think having a little bit more just openness about your own feelings, I think, is important as well. We're so concerned about how everyone else is feeling and doing that sometimes you forget, like, I'm still really important too. And in order for me to be the best I can be for them, I need to recharge or reset or just do something. And it doesn't have to be anything big, but just finding something small you can do for yourself that makes you feel better. But I will say that, the progress isn't always linear, which can be frustrating. I think we expect from the, day zero and then counting back up after transplant, it's always improving. Every day is better than the last. And it's not, which again is difficult, but even if it's not, better every single day, you may have a week or a month where things are great and then maybe they're not, and you stay there for a month and then they get better again. It does get better. It does. And so just, like I said, I think just staying hopeful, staying optimistic, on a day where you feel like you can't do it anymore, you just say one more day. And then every day, that's what we say, one more day. But it does get better. So I think, like I said, I think that even if it may not feel like it, or there's times that are really hard, you do get through them, and medicine's improving, research is improving. And I'm just so grateful for that. And be a donor.